So hi everyone, a very good morning to all of you from the Daily Transform. I'm Dr. Sumer. With me I have Dr. Deepthi, and it is such a pleasure to meet you all in the morning.
Right, a very good morning to all the dear bachas. I hope everyone is doing well. Yes? Okay, so as promised, we will be doing the session today to answer all your queries because, we keep saying that you want to ask so many things about strategy, about how to lift yourself up, right? And whatever you do wish to ask us, right?
So today what we have planned is we have planned that we will have a 60-second answer game that whatever you ask we will try to answer in a minute so that we can give time to maximum queries. So to set the ball rolling, I'll take the first query. Himanshu Goel has asked, "Sir, should I order the handwritten notes again and see the lecture that I have got 35,000 rank?" So, Himanshu, my suggestion to you is that if you have not done the classes before, you have not made the notes before, probably this is the right time that you work on your content. If you have done the classes, directly go on to App TND. If you have not done the classes, then use the App TND with the lectures first, then do the TND. You will see massive improvement in your section and improvement, but you have to first see what you have done so far.
Right. So, Himanshu, I would just add that if you feel by yourself you're taking a lot of time, then yes, use the handwritten notes. They will help you accelerate. But it's good to go through the videos to help clear your concepts and application. Okay?
ओके सो आई हैव वन मोर क्वेरी. एक बच्ची ने पूछा है, डॉक्टर दीप्ति आपसे पूछा है कि आई एम हैविंग ट्रबल फोकसिंग.
Right. So, if you have a trouble in focusing, number one thing, there are a few hacks that I want you to do. Maybe see where you are studying, right? It's a good idea to focus towards a wall, right? When you're studying rather than a window or an open area. Second, your seating area should be the same every day, okay? It helps you stay focused. Third, try and make well-defined targets. For example, instead of saying that I'm going to study for whole day physiology, it's a good idea to say in the next 1 hour in physiology, I will finish this. So start increasing your concentration bit by bit. तो पहले ऐसे करते हैं 40 मिनट्स पढ़ेंगे या 45 मिनट्स पढ़ेंगे 15 मिनट एमसीक्यू करेंगे राइट सो पोमोडोरो जो डॉक्टर सुमेर भी कहते हैं so after every 45 to 50 minutes, take a short break, but do MCQ rather than really taking it as a break. Maybe even just 5 or 10 MCQs.
So we'll take the next query now. एक बच्चा पूछ रहा है, सर I have a rank 7000. I want to integrate TND in my 2-month revision. So Shagufta, I'll quickly answer your query. Try give yourself 2 days per TND. Use the recorded INICET TND cycle from your App TND. ठीक है. एक INICET TND को, क्योंकि you are a 7000 ranker, you will probably take your PG seat from NEET PG also. So you want to do your best in the INI. So use the INI TND. Every 2 days give one test, follow it up by the discussion. Every 7 days give one GT. Gradually increase it to every 3 days and do the mission INICET videos from your revision course. And in the last week,
Also,
we'll add DBT.
yeah, also Shagufta, the fresh INICET TND cycle is starting from 1st of September. So some subjects you can start doing from the live and some from the recorded. We will be starting with the first and second year subjects. And they also give you the edge in INICET, right?
So I have another query by एक बच्चा मेहता जमीन के how to reduce distraction, how to come back. So I'll give you a very quick answer on the distractions thing. That my suggestion is, please remove the source of distractions from your vicinity. If it is your remote control, your TV, or your phone or laptop, it is better to go to a reading room and study, especially in the drop year, because sometimes what happens is if you're studying on your own in your home, you're surrounded by distractions. So good idea to go to a reading room and put on that 45 minutes Pomodoro for the focus study. Okay. And one question Arjun was saying, sir, my query is INICET TND available for App Live students? No, beta. So for App Live students, we have a special TND which has been designed for a live course student or a classroom face-to-face student. Like what is happening is, जब आप Archin, I'll answer your query. Try to understand. When you are studying with us in an App Live course, we are already teaching you everything. So App Live is the इक्विवेलेंट ऑफ द फेस टू फेस रेगुलर कोर्स. जितना हम फेस टू फेस रेगुलर में पढ़ाते हैं उतना ही हम ऐप लाइव में पढ़ा रहे हैं. इट इज सेम एज दैट. So now the teacher, when he is testing you, he needs to quickly wrap up and revise more things instead of teaching them again in the TND. So what we call that TND is, we call it as a fast TND. So you have a TND in your access which covers both NEET PG and INICET, but the pace of discussion is faster than a routine TND. That is the only difference. So you have a TND with you, which is enough. Don't go by just the name. It is called as fast TND because it is for students who are already studying with us. So try to understand. If I have taught you bone tumor by spending 3 hours, so in TND, if you are my classroom student, I will spend less time. If you are not my student, you are studying it for the first time, I might try to cover up the more ground. So that is why we call it as a faster TND. Okay. So Dr. Deepthi, one question for you. How many hours should we read, Kumar?
Right. So if it depends on which exam you are targeting, I will presume you're targeting for next year exams like NEET PG or INICET. So May INICET and June NEET PG. I would say start by maintaining a consistency of 6 hours and stretch it to 8 in the first phase of your study. And the first phase of your study should go from August until December end, right? Consistency is the key. I don't want you to burn out very soon. I want you to gradually pick up pace. So a 6 to 8 hour of consistent study is excellent and it is probably very, very good, right? Most likely, बाद में even you will not need a lot more to do. But consistency is the key, bache.
So I'll take a quick 1 second query only. Sir, will I get handwritten notes hard copy for TND? No, beta. Handwritten notes hard copy are not a part of your subscription. You might have to purchase them extra. So I have a bacha who's saying, sir, when will be the online career counseling and how it is different from offline? So this year what we've done is, we have now gone a step further. We have requested the teachers to give their time from their clinical schedule and give that time to the students. So most of our teachers are also busy clinicians and practitioners and surgeons. So they're all busy in their practice. So we have asked them, can they give us time slots? So those time slots are now available in the mentor desk. You can book a one-on-one career counseling with directly with the subject that you are asking to. Try to understand. Suppose you want to join psychiatry, you don't want to listen to all other teachers, you only want to listen to the psychiatry faculty. So you can book a one-on-one slot and have a detailed, maybe half an hour, 45 minutes discussion with the psychiatry faculty and ask all your doubts. So this is available now on the DAMS mentor desk. The face-to-face event is a mega event where everybody will be available to you face-to-face for your asking your queries, and including me, Dr. Deepthi, all faculty. That will happen on 10th of September. The seats are filling up. Please block your seat before you miss that opportunity. Okay. So Dr. Deepthi, madam, for INI is going to be my last exam. Should I still do B2B?
Right. So it totally depends on your number of correct questions, bache. If your number of correct questions is, let's say, 140 or beyond, you can start with whatever notes you have, you revise, give the TND, but do B2B very selectively. For example, in the TND, you get to know, yaar, gynae mein mera hormone wala part bahut weak hai. Then it's a good idea to just see this part from back to basics. So, we will do it very selectively for the topics that we are doing wrong. And maybe usme bhi aap narrow kar sakte ho from the topics that INICET is fond of asking. So which you will get to know through INICET TND, through Mission INICET or INICET PYQ का बाप, right? उन topics में से अगर आपका कुछ weak है, आपको पता है, तो उसके लिए please, yes, selectively go back to basics, okay?
Okay, and how do I plan my day using App TND? Diksha, I'll tell you one rule. App TND के लिए ना, you make one rule. I will attend the TND discussions live. Make that rule. ठीक है, मैं live attend करूँगा. So now you go to the schedule icon in your My Study section and you see the upcoming live TND. Before that, you finish. If you have already attended DAMS lectures, finish your notes. If you have not done them, use the Back to Basics or Cortex AI Golden Points or handwritten notes. But do something, study, then give the live test and attend the discussion with the teacher. So when you attend it live, because after the live session, recorded version is also available for you. But once you attend it live, it makes it like you are more in schedule and more like in discipline. So if you plan your day with this, it will help you a lot. Okay. So I see one or two queries. Madam, please tell something, but I don't know what is the query. So let me just push. एक बच्चा कह रहा है, how should a working doctor in a rural service study schedule since we hardly have time?
Okay, so if you are working, it may be a rural setup or anywhere. We need to make it important that jitna bhi hame time mile, let's say it's 1 hour, 2 hour, 4 hour in the day, we are doing something which is concise, which is crisp, yet very, very high yielding, right? So maybe if you feel that your concepts are okay, you can use the live rapid revision, you can use the DVT. But as I mentioned previously, if you have less time, if your concepts are weak, then they don't match. You will have to give time. Then I would recommend please see the back to basic full videos. At least start with big subjects because in NEET PG, surgery, obs and gynae, medicine, PSM, path, pharma, ये सब बहुत बहुत आता है. Integrated भी, direct भी, right? So
So I totally
depends.
agree that for in job candidates, back to basics is the ideal course, which you can use in your job also. You can do it later also because you may not have the time. But back to basics is very crisp and it is doable. अब आपके मन में आएगा उससे छोटा कुछ नहीं हो सकता, लेकिन बेटा फिर तेरे कॉन्सेप्ट्स जो भूला हुआ होगा वो कैसे बनेंगे? So back to basics is the ideal thing for
And
you. It can be done in 4 to 6 months.
I would just add very quickly that Wazifa, no doubt you have to do B2B or you have to do your live rapid revision for some subjects, but testing has to be the key. So जब आप वहाँ बैठे हो, if you have time, even when you are on duty, maybe एक छोटा सा कोई मिनी टेस्ट कर लें, एक GT दे दें, एक क्लास टेस्ट कर लें, एक सब्जेक्ट वाइज टेस्ट कर लें. So ensure that you are incorporating some form of testing also in your schedule, bache. Okay?
Okay, so I have a query. How to review? Jay has asked how to approach GT and how to review. So if you are preparing now for NEET PG 2026 or 2027, you should start with one GT every 30 days. After submitting your DAMS GT, you should see the video solutions of your mistakes. These are the two things that you have to do. Third is, for your mistakes, just keep a wrong diary in which you will jot down when you're listening to the videos some key points. Don't overdo it क्योंकि शुरू में ज़्यादा गलतियाँ होंगी तो ज़्यादा बड़ी डायरी नहीं बनानी हमने शुरू में कम करेंगे धीरे धीरे अपने आप कम हो जाएगा. So Jay, the goal is suppose you get 100 correct. But the key is the 100 wrong that I have got, I need to hear the teachers so that I don't make that mistake again. Gradually, what will happen is, I have seen this year students who have followed our formula, they have improved from 100 to 150, 170, 180 also. And so it is very important to keep giving them and review your mistakes from the video solutions.
I would just add, Jay, that wrong diary, अगर आप पूरे 19 subjects के एक बारी में नहीं बना पाते हो, please start with bottom 3 subjects. उससे क्या होगा? You between 2 GTs, you work on those 3 subjects का wrong questions. Next GT में some other will come in bottom 3, and by this method, by rotation, you will stay in touch with all 19 subjects, beta. Okay?
And एक बच्चा पूछ रहा मेहता कि how to gain my confidence back. So बेटा सिंपल है, by winning somewhere. कहीं जीतेंगे तभी तो कॉन्फिडेंस आएगा. तो डेली क्विज देना ऐप के ऊपर, केस ऑफ द डे आंसर करना बेटा. रोज टेस्ट में कुछ कहीं तो जीतने की कोशिश कर, क्लास में आंसर कर, इतनी कोशिश कर कि टीचर मेरा नाम बोले. अभी जैसे मैंने तेरा नाम बोला, मैं कह रहा हूँ तो अच्छा स्टूडेंट है. यही मैं क्लास में क्वेश्चन पूछूंगा, तूने आंसर करना है. और अगर मैं बोलता हूँ बेटा यू आर डूइंग वेल, यू विल गेट कॉन्फिडेंस. यू नीड टू अकोमोडेट सम विक्ट्रीज.
Jay, Dr. Sumer is absolutely right. Tiny victories is the key. So daily quiz, mini test from Transform 10x, DQB questions. थोड़े थोड़े जब आप इसका हैबिट बनाओगे बेटा, ग्रेजुअली आपको कॉन्फिडेंस आएगा कि नहीं यार मैं ठीक से सही कर पा रहा हूँ एंड आई एम नॉट दैट बैड, आई कैन गेट बेटर एंड आई कैन बी देयर. ओके
ओके, एक बच्चे का क्वेरी मैं ले लेता हूँ. पवन के पूछे, सर एवरीवन इज सेइंग टेक रेडियो बट आई लव मेडिसिन. तो भाई एवरीवन ने तो नहीं करना ना, करना तो तूने है ना. सो इम्पोर्टेंट इज टू फॉलो योर हार्ट. इफ यू लव मेडिसिन, यू हैव नॉट रिटन लाइक. समझ पा रहे? लाइक और लव के अंदर बचपन में भी सिखाया गया होगा. यू लाइक सम पीपल, यू लव वेरी फ्यू पीपल. सो तू लव कर रहा है मेडिसिन को तो मेडिसिन कर ले यार, क्यों बाकी सबके सुन रहा है. सो do what you love today, and that is the message, that follow the branch that you love. You may fall in love, you may say कि सर कल मैं पैथो करता रहूंगा, वो भी मुझे पसंद आ जाएगी. वो तो सब कुछ अल्टीमेटली आ जाए, लेकिन आज you should follow your passion is my answer. Okay. Okay, a query है, how to revise? I tend to forget subject about after reading. Vishwajit, leave it on us.
Okay, but yes, if you have read the subject once and let's say you want to revise it today and you know you feel कि ये तो बहुत सारा है कैसे होगा, I will suggest go to back to basics. Don't see the videos. Press Cortex AI underneath the video. उस हिसाब से आप 15 मिनट में वो 1.5-2 घंटे का वीडियो रिवाइज कर लोगे with all key points, right? So Cortex AI is wonderful. You will get all key points. You will revise. You will not have a FOMO, and it takes less time if you have done the subject once. Okay.
Okay, see, इसी के साथ ना, I think the next query is also related to it. I'll just pull out the next query. Okay, what is the sequence in which I should do TND LR DVT PYQ kebab? So Akshay, my answer is, देखो, it depends on the time that you have. Suppose you are preparing for NEET PG 2026. First 4 to 6 months should be back to basics plus TND.
Yes,
This
I
back to
agree
basics can be
completely.
replaced by, it can be replaced by app live or face to face if it is present or you have access to live classes or face to face classes. लाइव क्लास का मतलब होता है ऐप लाइव क्लास, जो ऐप पे टू वे हो रही है. फेस टू फेस का मतलब जो क्लासरूम में जाके आप पढ़ रहे हो. डैम्स में हर तरह की क्लास है. So first is content which could be either face to face, app live or back to basics, minimum back to basics plus TND 6 months. उसके बाद अगले एक महीने में should be live rapid revision, which we will also do live with you, don't panic, and we will try to cover it with you. Final month में we will try to do multiple times DVT, and PYQs
Okay.
can be done anytime. I'm sure you know you
I'm just
probably.
going to take a minute and answer Akshay's query in very short method for everyone out there. जिसको समझ नहीं आ रहा है कब क्या रिसोर्स कैसे यूज करना है, मैंने ये डैम्स ऐप पे भी डाला था और कल मैंने इंस्टाग्राम पे कैरोसेल भी डाला है where I have divided your study into 5 phases and in quite detail I have told you which ones to use in phase 1 which is from August to December, which one to use in phase 2 from Jan to mid-Feb, then further from mid-Feb to March. So I have made 5 phases and with that method you will be able to cover your ground in detail also and do good number of revisions as well. So you can go on to my Insta profile and see it, or you can go to DAMS Alpha article section homepage, press view all, and you will see various articles that me and Dr. Sumer also post upon strategies. Okay.
Okay, so let me take the query. I think we have a lot of queries running.
Yeah, just
So what
keep
is the
taking.
schedule for FastTrack TND? I think if you are already in a classroom course, just click on the schedule icon. You should see the schedule. I'll request Dr. Deepti also to share the full schedule of FastTrack TND today, either on YouTube or all in the Telegram.
Will do, will do.
Okay, and I think a lot of queries are there. Okay, sir, you said I should do 50 questions minimum every day. Is it topic that we are studying or randomly? So, beta, my answer topic that you are studying. जो टॉपिक आप पढ़ रहे हो, जिसका टीएनडी आने वाला है, जिसकी फेस टू फेस क्लास कर रहे हो या जिसको आप ऐप से पढ़ रहे हो, दोनों तीनों में से जहां पे भी हो उसके करने. सो इट इज द टॉपिक दैट यू आर स्टडिंग. रैंडमनेस में ना कंप्लीशन की फीलिंग नहीं आती.
और ना आई विल ऐड बिकॉज इट्स अ वेरी गुड क्वेश्चन बच्चे आरजीडी कि आप बोल रहे हो आप टीएनडी कर रहे हो तो कौन से करें. सर ने आपको एक आंसर दे दिया टॉपिक वाइज एमसीक्यूज, साथ में मैं ऐड करूंगी डू पीवाईक्यूज ऑफ दैट सब्जेक्ट जिसका टीएनडी आ रहा है. सो इन द डीक्यूबी जैसे अनाटमी है तो अनाटमी के टॉपिक वाइज एमसीक्यूज हैं बट उसी के नीचे अनाटमी के पीवाईक्यूज भी हैं. So you should include that also during your week for preparation for TND. Okay.
Okay, again we see, I think similar query. Dr. Neeraj ne pucha, sir, I'm not able to sit and concentrate. I think Neeraj, the good idea is change the place, go to a reading room, put an alarm, and you need a clock like this. I'll just show you. You need a clock like this on which you can put an alarm for 45 minutes, and don't get up, don't touch the phone in this 45 minutes unless Trump is calling you for some tariff review. And उसके अलावा अपन फोन में 45 मिनट्स तक फोन नहीं उठाएंगे. And do the Pomodoro. You will start feeling better. There is a detailed video by me on Pomodoro technique on YouTube. That is also what I would recommend you to see. Okay, another advice from you. How should be my preparation in 2024? My rank was 1.3 lakh, 2025 63,000. Archin.
Archin, I really don't know how you have done your preparation. You've come a long way, but there is still a long way to go. So I usually say any bacha who is beyond 40,000 rank, Content is your major issue, beta ji. So concepts and application of concepts, मुझे लगता है आप massive improvement करोगे if you attend the classes with us, right? And learn the concepts and the application, and it is worth your drop year. If you feel that, ma'am, I've already done the classes and I'm okay with concepts, but I need to read it again, I need to review it again, then I will say the best method after doing the classes once is follow up with TND. They give time to you to study and revise, but at the same time, it also helps you to learn the application, MCQ skill, updates, how to rule out, and so many other things. Okay?
एक बच्चे क्वेश्चन है सर, आई एम गिविंग स्मॉल टेस्ट तनुश्री एंड डूइंग ट्रांसफॉर्म टेस्ट लेकिन आई एम स्कोरिंग लेस, हाउ टू इंक्रीज द स्कोर? सो बेटा आई विल गो द रिवर्स वे. अभी इंक्रीज द स्कोर की जगह सोच कि तुझे फायदा हो रहा है, कि तुझे पता चल रहा है कि तुझे क्या नहीं आता, नहीं तो असली एग्जाम में पता चलता. प्लीज यूज दैट एज अ गाइड टू रिव्यू योर मिस्टेक्स फ्रॉम द solutions given to you in the paper. At least review your mistakes so that that mistake doesn't happen in the future. Gradually your number of mistakes will reduce and you will start scoring better and better.
I want to just say, कुछ बच्चों को लगता है कि MCQ हमारा कंटेंट इंप्रूव करेगा. ऐसा नहीं होता तनुश्री. MCQ helps you to apply your content. तो पहले हम कोशिश करेंगे कि we focus on content as well, right? So जिस भी सब्जेक्ट की आप तैयारी कर रहे हो, इंश्योर करो आपने वो पढ़ा है, यू आर गुड विद कॉन्सेप्ट, है ना बच्चे? फिर अप्लाई करेंगे, देन टुगेदर दे विल बिकम द बेस्ट कॉम्बिनेशन.
ओके, एक बच्चा कह रहा है ऐप लाइव भी TND दोनों है, मैं अभी क्या करूं? सो बेटा, बिकॉज यू आर इन फाइनल ईयर राइट नाउ एप्ली, आई विल गिव यू अ वन लाइन आंसर. स्टार्ट विद ऐप लाइव. ठीक है, अभी कुछ सोचने की जगह रोज क्लास अटेंड करना शुरू कर दे. गेट इनटू द रिदम. एक हफ्ता, 10 दिन, 15 दिन, यू विल फील द रिदम कि रोज, मतलब आदत होनी चाहिए ना. मैं जैसे स्कूल में आदत होती थी ना, वैसे होगी. कॉलेज से आए, टेबल पे बैठे, टेबल सेट किया, आईपैड लगाया अपना या जो भी टैब लगाया, बैठे, डैम्स की क्लास अटेंड की, थोड़ा थोड़ा वर्कबुक में नोट बनाए, फिर अगली क्लास. इसको फॉलो कर, यू विल सी massive changes in your concept, because the biggest thing that we are bringing to you through App Live is we are bringing the full regular course that only earlier in big city students had. Now it is coming to you in your tab.
Gayatri, but I also feel you are someone who wants an edge over others, right? So what you also should do is, sir is right, do your app live. But I would suggest, since you have TND, start using the TND of only your final year subjects, right? Because आपके final year subjects should be very thorough. So उनकी class भी करो और उन्हीं subjects का TND भी करो. The remainder of the TND, बच्चे, you can start with your internship as well. But for the final year, it will give you an edge if for those subjects you start covering the TND. Okay?
अच्छा, डॉक्टर दीप्ति, एक बच्चे क्वेश्चन है, व्हाट शुड बी स्ट्रेटजी ऑफ फेस टू फेस रेगुलर स्टूडेंट? सो कार्तिक, आई गिव यू अ क्विक आंसर. ठीक है, फेस टू फेस स्टूडेंट, योर गोल शुड बी गो टू द क्लास blank mind, don't go with prejudice. Use the workbook to interact with the teacher, answer in the class, interact, make notes. So that will make the first part layer of your concepts. Same day, read the notes once, so that you know it is consolidated in your head. Then follow it up by daily 50 MCQs from the DAMS question bank on the subject you were taught the week before. Then appear for the class test after 7 days on your online test series, and the FastTrack TND whenever it happens. Follow that also side by side. So this should be your goal in face to face.
Okay, Karthik Raja, because sir had a lot of points for you, you may not be able to retain all of them. I would just say, please go to DAMS Alpha, go to the article section, press view all. Me and Dr. Sumer have put an article and it goes like, how to plan your study with DAMS app live or face-to-face classes, strategy and resources. All the points have been very clearly put there. How to use them, when to do DQB, how to give GT, when to revise, what things to use for revision. Everything is written there, bache, and you can use it multiple times. So you can go back and see and follow the pattern. Do let us know if you have any other queries. Okay, so एक बार उसको पढ़ लो अच्छे से.
एक बच्ची क्वेश्चन है, सर आई एम 73,000 रैंक, इफ आई बाय TND should I do all B2B lectures or subjects in which I lack concepts? So you start with subjects that you lack concept, वहां से शुरू करेंगे. लेकिन मेरे बच्चे, मेरे पास ना बहुत सारे बच्चे ऐसे हैं जिनसे मैं बात करता हूँ, कहता हूँ सर जो चीज मैंने डैम्स में पढ़ी वो तो याद है, जो मैंने रैंडमली किए वो आखिर तक मेरे वीक रह जाते हैं। सो स्टार्ट विद योर वीक सब्जेक्ट्स, ग्रेजुअली कवर एटलीस्ट जैसे शुरू में क्या होगा, तू वीक सब्जेक्ट सोच रहा होगा बेटा, धीरे धीरे देखो वीक टॉपिक का आइडिया आएगा। मतलब समझते हैं जैसे शुरू में तो 4-5 बड़े सब्जेक्ट मिल गए, ये मेरे वीक है, लेकिन जब मैं रैंक 73,000 ला रहा हूँ तो बाकी सब्जेक्ट्स में भी कुछ टॉपिक तो मेरे वीक होंगे ना। सो यू स्टार्ट डूइंग देम
Absolutely.
फ्रॉम B2B एंड यू विल
Yes.
फाइंड massive improvement happening in your
मैत्री, नहीं तो क्या होगा बेटा, अगर आप हाफ हार्टेडली कुछ ही सब्जेक्ट्स करोगे तो क्या होगा, यू विल इम्प्रूव फॉर श्योर, बट अगली बार फिर कहीं बॉर्डर लाइन पे आ जाएंगे एंड यू मे नॉट बी एबल टू गेट व्हाट यू रियली वांट एज अ ब्रांच। सो आई वुड से जब हम ड्रॉप कर रहे हैं, वी विल नॉट डू हाफ हार्टेड, है ना। एट 73K बेटा, हर सब्जेक्ट में समथिंग और द अदर मस्ट बी अ लिटिल लिटिल lacking, and therefore our genuine advice is do B2B before every TND. It will give you what you really need. Then do the TND and learn from it as to what are your gaps in the study or concepts or application. Okay.
Okay, quick answer is Sumaya Khaman. Which GT should we give for INI preparation? So on your online test series, you will see a section called as INI-CET mock tests. They should be prioritized. You, what Dr. Deepthi always advises, alternate one GT routine
Yes.
pattern grand test, one INI mock test, one GT, one INI mock test.
And for everyone who is here with us in the chat box, this Sunday on the 30th, a new INICT mock is also going to be added. So we already have 11 mocks. There will be another one this Sunday. So I would request everyone preparing for INICT to give that INI mock. Okay? It is available in your test series.
एक बच्ची ने पूछा सर when will the INI PYTs of rest of the subjects be uploaded? In process, we are doing it. It takes time to accumulate all the
Yes, we have
important
uploaded
points.
4. We'll upload a couple of more today or tomorrow, right?
Okay. Sir, I have already done face-to-face classes in 2024. My concepts are not up to the mark. I am preparing for INICT. Beta, you should follow it with App TND right now. बिकॉज एक बार आप क्लास कर चुके हो, नोट्स बना चुके हो, लेकिन फिर भी कॉन्सेप्ट्स नहीं बन रहे। लेकिन कौन से कॉन्सेप्ट्स नहीं बन रहे ये पता नहीं चलेगा जब तक हम टेस्ट देंगे, गलतियां होंगी, फिर टीचर से डिस्कस करेंगे तो फायदा मिलेगा। सो टेस्ट ऐप टेस्ट एंड डिस्कशन विच इज ऑन द ऐप, विच ऑल्सो गिव्स यू एक्सेस टू दी B2B, क्योंकि 2024 से अगर कोई लेक्चर में अपडेट आया होगा वो भी तेरे को वहां पे मिल जाएगा, and you will get TND also. Maitri, that should be the way forward. Okay, how many GT should I give if I am targeting INI May Conqueror, and how to deal with subjects like molecular biology? So बेटा पहला मेरा आपको आंसर है, start with one every 30 days. Once 30 days is in control, we'll go on to 15 days. ठीक है, अभी मई में पेपर है तो अभी 30 डेज में एक से शुरू करते हैं। If you feel in control with everything else, then we'll go on to 15 days and gradually reach up to 7 days and 3 days.
I think I completely agree, especially up till November, December. Try and give one every 30 days, and then we will increase the frequency after that. Okay?
अच्छा, एक बच्ची का क्वेरी है कि शांतन का क्वेरी है बच्चे का कि सर टीएनडी में रॉन्ग सॉल्यूशन देखूं या फुल वीडियो? टीएनडी में फुल वीडियो बेटा, टीएनडी
एक बार
फुल
तो
वीडियो।
देखना चाहिए।
Because what we have requested the teachers in TND is that even if you are discussing one question, TND is more elaborate than a test series discussion. TND is a discussion around that topic,
Yes,
and
we will
our
be covering PYTs. Yes,
and
as well as
we tell the teachers that cover the entire subject in a crisp manner, covering all the PYTs with the discussion. So we cover your full subject. So TND, there is no way you should skip the full video. Shantan, listen to me. I am, waking you up. पूरा video करना बेटा, पूरा video. Okay.
एक बार जरूर करना शांतन, you will get confident about it.
App TND schedule is, once you register, you will see it in the schedule section. But today we'll share the TND schedules on the Telegram channel again. एंड आई सी एक बच्चा कह रहा है कि सर मैंने फेस टू फेस डर्मा शुरू कर दिया, अभी अच्छा भी लग रहा है, मैंने सब्जेक्ट पढ़ लिया, उसके PYQ भी कर लिए। अब बेटा आपने क्या करना, उसके DQB से स्टार्ट डूइंग 50 क्वेश्चंस एवरी डे फ्रॉम द DQB ऑफ डर्मा, so that you feel more confident. Then next week start the next subject. So what is your opinion between DNB in a Delhi college, state college for general medicine? इसके ऊपर ना let's have a bigger debate, MD versus DND.
Yeah, it's
but
not that easy.
so it usually depends on what are your aspirations from life, where do you live, where do you want to settle down, and uh, and always is, do you have academic aspirations in future? You want to join a medical college as a faculty? So all those things have to be considered before we take the final plunge. I think we'll dedicate one separate video to MD versus DNB. Okay. FastTrack Live TND has not started yet. When will it start? So FastTrack Live TND is now a part of your app live and also included in the face-to-face subscription. It will start in September, I think.
Yes.
Yes, and we will be giving you the schedule today. For by I think today we should be able to share the schedule with you. I will also see if I have it in my computer. I'll share it now.
Usually, you bachas, whoever have access to the course can see the schedule on the app itself. But yes, if you haven't purchased the course so far, you may not be able to see the full schedule. Okay. Not gaining confidence to restart after result. So, you have to tell yourself that if you are not going to restart, then you are anyways, have to manage with whatever is in your hands right now, beta. So, instead of seeing restart as a hurdle, take it as an opportunity. I know it is difficult, and that's why we said start small, okay? And try and gain small victories. When you do that, gradually, धीरे धीरे थोड़ा सा confidence आएगा. Also, when you talk to the teachers every day, they'll boost you up because we know that you have a lot of caliber. You're going to put in the effort. Just tell yourself, I am out there trying to work and improve the choices that I would have in life, right? I don't want to settle for less, and therefore I want to ensure that I have more choices, and that's what I'm working for. Okay, you're already a doctor. Nobody can take that away from you. ठीक है, so in this exam you haven't lost anything. समझ रहे हो मेरी बात? कुछ खोया नहीं है, जो था वो तो अभी भी है. Just that new opportunities और चाहिए, उसके लिए हम मेहनत करेंगे. ठीक है?
Okay, and I think we had a query in between we missed out. Okay, so DAMS Alpha notes are correlated with both App Live and B2B. दोनों के साथ अब same है, and they're all based on workbook. So
Yes.
Vigneshwaran, App Live and B2B both are now based on the same workbook and the notes are same. Okay.
Even regular face-to-face classes, all, no matter what course you're doing with us, whether it is App Live, B2B, or face-to-face, everything is workbook based beta. So you will find the same teachers teaching the same content. The modes are different depending on what the student finds best for themselves. Okay?
And how to overcome exhaustion by reading again and again?
Change the mode. Okay, for example, इसीलिए I always say every reading has to be in a different method, right? And it should take lesser time. So for example, if you've done your notes once, don't start reading them anti-grade now. Maybe use it through a TND, right? That's what we say. So पहले आप अपना paper देके देखो, see what you lack, what are your weak areas, focus on that. ठीक, but at least 2 times अपने मेन नोट्स को एक बार रीड जरूर करना है, दैट इज इंपॉर्टेंट, बट द मोड कैन बी डिफरेंट. ठीक है, एंड एवरी टाइम इंक्लूड अ डिफरेंट टेस्ट पेपर फॉर इट. फॉर एग्जाम्पल, अगर आप टीएनडी का पेपर अभी कर रहे हो, नेक्स्ट टाइम यूज अ क्लास टेस्ट, नेक्स्ट टाइम यूज एन SWT. That way what will happen is every time you will get to know different weak zones and you will be getting stronger and stronger with every reading. Okay.
Okay, so let's see. I have बच्चा कह रहा sir, I've only completed 3 subjects. What should be my approach in GT? So it should be like you start appearing as a ritual. Jay,
Yeah.
abhi, it is not like you're judging yourself. It is like you building up the ritual that every month I will give 1 GT. Is bar I have done only 3 subjects, so maybe I will get less number of corrects. But next month you will do 3, 4 more subjects. You should improve. So that should be the goal.
And Jay, I would just add, from the 3 subjects that you have covered, in the GT, focus on what you have done wrong in these 3 subjects. So that will help you in reviewing these subjects, give you confidence as well. By the time you will cover more ground. Okay?
So एक बच्चे को query है face to face में TND available नहीं बेटा. I think you are getting it wrong. In face to face students we have included a special TND which happens live for you on the app called as the fast TND, because you've already studied with the teacher. It is on a slightly faster mode, but it is available for you.
I will also add something. You have lots of tests and videos available to you when you are a regular batch student for us. Okay. For example, class tests with videos are there. Okay. SWTs with videos are there. GTs always come with video solutions. So there are multiple tests available to you with videos which you are going to utilize in the same way like you use the TND. Okay. Apart from the fast track TND, which will be live.
So Rahul Tyagi has asked, when will career counseling start? So DAM's career counseling will happen in Delhi on September 10th. You can book your seat on going on the event section on the app. We have already started the online counseling on the app. You can book the slot with the teacher concerned. So what we have discovered last year is that suppose you want to talk only about anesthesia. So it is very difficult for you to hear every other subject then reach to anesthesia. So this year what we have done is you can directly book a slot with the anesthesia faculty on the mentor desk in the app and talk. You can have your parents along with you or anybody who matters and have a discussion with the teacher directly. So that is already started. You can book your slots on the app now.
Okay, Dr. Sumer, I think the queries will continue. So what we'll do is we'll keep an upper limit of 40 minutes for today, and maybe we will do another AMA session tomorrow. And we'll try not to repeat the queries of the students who've asked today, just to give more chance to everyone around. Okay?
So, Kunal Doshi, I think this would be the final query that we take. Sir, I'm in third year and how can I join DAMS? So, there are two things to remember. Kunal, if you have DAMS in your city face-to-face center, so then join it at this moment and try to attend maximum amount of classes face-to-face. Usually in third year, most of the times you'll see weekend classes in most cities happening. So, you will have a Saturday, Sunday maximum, sometimes Friday, Saturday, Sunday. And this attending the lecture, if you miss anything, you have a backup on the app also. So as a face-to-face student, you also get access to App Live, on which every day a live class is happening with the same faculty members, and you also get access to recorded lectures so that if something is happening in your prof, like suppose in DAMS you're doing surgery, but your prof is of ENT, you can directly go to ENT lectures in Back to Basics and use them. So if third year your goal should be start building the concepts and notes for every subject. Target कि by final year मैं 19 subjects के notes बना चुका हूँ. That should be your goal, बेटा.
I will just add, beta, if you cannot come to a face-to-face center, you'll get the same
App Live.
thing in App Live as well, right? So if you feel that you can't go to a class, you want to do it at home, then yes, definitely use the App Live. The classes are in the evening, like 5 p.m. So when your college is over, they are like for 4.5, 5 hours. So they give you the consistency also every day. So in the morning you can do your lectures and in the evening you can do the class as well. In case you miss any class, the same classes after the live are also put up as a recorded section. Okay.
So I think one very quick query, it is mainly technical. कि, sir, I have a rank of 31,000, want to target the November exam, which is a very good idea. Is there a TND available? So DAM's only one TND is available on now, which is called as App TND, which includes NEET PG TND cycles also, INICET cycle also. And for November, we have introduced a special 3-month subscription, which is available on the app for subscribing.
Okay, I'm just going to add something. Please don't take me otherwise. But say from 31,000 to coming to under 100, I think you are really pushing yourself very hard because you have just about over 2 months. I hope it is
The question
not
is
your
that
exit plan.
if you are going to join the PG seat with this rank, then you can target the November exam.
Yes,
But
that is fair. That
if
is
you are
fair.
going to leave it, ये इसलिए थोड़ा सा इसको इंडिविजुअली और डिस्कस कर लेते हैं. अगर तेरे को लगता है इस सीट पे जो मिल रहा है वो मैं लेने ही वाला हूँ और सिर्फ नवंबर का मैं चांस लेना चाहता हूँ, गो विद द TND 3 मंथ सब्सक्रिप्शन, गुड आइडिया.
Absolutely.
बट अगर तुझे लग रहा है कि मैं यहाँ पे नहीं लूंगा, देन कीप दी ऑप्शंस ओपन फॉर द मे ऑल्सो, क्योंकि 2-4 महीने एक्स्ट्रा पढ़ के अगर मैं अपनी चॉइस का सब्जेक्ट ले सकता हूँ तो और अच्छा क्या होगा.
Exactly.
दैट इज व्हाट
Exactly my
डॉक्टर
point.
दीप्ति meant. So our goal as mentors is to give you the correct picture also. So think about it, that are you going to join what you're getting through this rank? That will help you to make a good decision, beta.
Okay. So I think that will be it for today. We tried to answer quite a lot of queries. Don't worry if your query is not sorted or we haven't addressed it yet. We will do another AMA session tomorrow. Please join us on time, and yes, we will try and take queries of other students other than who have asked their query today. Okay, because I believe this is something which I know there are many queries. So maybe we can plan a longer session also tomorrow. We will do that for everybody. Okay?
So, today we tried something new that we will answer your queries in 60 seconds. So, we tried our best to do faster, so that we can touch more lives, make sure that we are able to give you all the individual time that you seek with us. This year, we have taken a big plunge ahead by starting one-on-one on the DAMS app. India ka pehla one-on-one where you can book on the app, directly through the app, you can talk to the teacher. It is there on your app for career counseling. We have opened it now. Because अगर तुझे psychiatry लेनी है तो why should you hear everything else from other teachers? Go directly, book a slot with the psychiatry faculty, with the anesthesia faculty, respiratory faculty, medicine faculty, wherever you feel that this is the branch I want to offer. The slots are open for you to book. I wish you all the best.
Take care, everyone. Have a wonderful day ahead, and best wishes from our side.
Bye, beta. Bye.
Bye, everyone.